a psychiatrist and a sleep physician. I'm also clinical professor at University of Oklahoma, but associate professor at UT Southwestern as well. And I have a practice in Grapevine. Now, I was here just a few months ago, and we talked about mental health disorders. That was a whole review of mental health disorders. But this talk is a bit different. This is about sleep. So how many of you know people who have had some trouble with sleep? Okay, so most of you know at least somebody who's got trouble with sleep. And most of us don't get enough sleep. So we spend about 30% of our lives sleeping. You can imagine, if you get to be 90 years of age, you've spent about 30 years sleeping. That's part of your life. So that's extremely important. Everybody needs sleep. Yawning is contagious, so I don't want anybody to yawn, okay? No, most of us don't think sleep is our priority, and that's a problem. Because we think that we can live without sleep, we can function without getting enough sleep. But that doesn't happen very well. And most of you know that. And I'm going to show you some more data, some information about that. Now, you can do this, you can compensate by drinking. How many of you drink coffee? Okay. So do you know that what coffee does to you? Okay. So when you're awake for a longer period of time, there's a chemical in the brain called adenosine, which starts building up in the brain. It tells the brain it's going to be time to go to sleep. So the more adenosine you have in your brain, the more sleepy are you going to get. Okay? What coffee does is it blocks that. So it blocks the receptor, so that's why people get more alert. But then it has other side effects. So coffee can cause problems. I'm not saying it's unhealthy, but just to stay awake and be a substitute for sleep is not a good idea. Yes?
What about tea?
What is that?
What about tea?
Tea has, yeah, it has less of caffeine, so it may not be a bad idea. But if you're using tea to keep yourself awake, it means that you're having some problems. You're either sleep deprived, you have a sleep disorder. So obviously, drinking coffee 1 or 2 cups is fine. But what my point is, if you're drinking coffee like this guy, it's because he's compensating for not sleeping well, not sleeping enough, or masking some of his sleep symptoms because he may have a sleep disorder. So that's what my point is. Now, sleep problems are very common. I'm a psychiatrist. I'm also trained in sleep medicine. I trained at the Mayo Clinic, sleep medicine. But if you look at psychiatric clinics, 90%, or sometimes 80 to 90% of our patients who come in for depression, anxiety, even ADD, any of those psychiatric disorders, they're going to have sleep problems. You can't think of any psychiatric disorder where sleep is not disturbed. Most people who have any anxiety, depression are going to suffer from some sleep problems. Now, there are consequences of poor sleep because if somebody is not getting enough sleep or they have sleep disorders, they're going to have fatigue, they're going to have proper problems. Now, how many of you have had times where you kind of almost dozed off on the wheel? Raise your hand. Yes, all of us. So it means that we should not do that. If you're doing it on a consistent basis, it means there's a problem. Either you're not getting enough sleep or you may have a sleep disorder. So it's risky, it's very risky. No, all of us, how many of you feel sometimes that you're drained and frustrated? That's good. How many see that you're able but really not, kind of not very motivated or unmotivated? How many of you want to be like this? Energized and ready to go? Just a few? All of you, yes, absolutely. So what you want to do is you want to make sure that your sleep is a priority for you. Your mental health, your emotional health, your physical health, but also your sleep health is a priority for you. Because if you're not paying attention to it, no matter what you do, you're not going to do very well emotionally, and physically, or motivation-wise. And not all 8 hours of sleep is the same. You may think I get 8 hours of sleep, but if a person has a sleep disorder, they're going to have trouble with feeling more alert. Okay?